Hello and welcome to the NICU Space podcast by Miracle Moon. I'm Dr. Frankie Harrison, a clinical psychologist and NICU parent myself. Through my work as a psychologist and through my own experience of having a baby in neonatal care, I know that the NICU journey can leave a huge emotional impact on parents and families. This podcast is a space where we talk honestly about that experience. We will be exploring the emotional impact of neonatal care, the anxiety, the guilt, the grief, the questions about bonding and identity, the parts of the experience that so many parents carry long after leaving the hospital. Across the series, I'll be speaking with other NICU parents at different stages of their journey, as well as professionals working in the field. We want you to feel seen, understood, and less alone in what you've been through. So whether you are currently sitting beside an incubator, recently home from NICU, years down the line still making sense of it all, or someone supporting a NICU family, you are very welcome here. What you have been through matters, and you do not have to carry it on your own. Before we begin, just a quick note that this podcast is for information and support, but it is not a substitute for individual medical or psychological care. Now, let's get into today's episode. Hello and welcome to the NICU Space podcast. Today I have got Dr. Julianne Boutaleb joining me. Julianne is the clinical director and the founder of Parenthood in Mind practice and an associate fellow of the British Psychological Society. She is a highly experienced perinatal psychologist who has worked for 25 years in the NHS and private practice with individuals and couples with fertility issues, miscarriage, stillbirth, reproductive loss, and trauma. She specialises in supporting those who are pregnant and parenting following ART, IVF, ICSI, donor conception, surrogacy, or adoption. And she writes lectures on these issues too and has regularly contributed to the press. She's appeared on BBC 4 Women's Hour, BBC Radio 5, Channel 5 to offer expert opinion on mothering after bereavement, infertility, and donor conception. She was a nominee for Best Fertility Psychologist Award by the European Fertility Society in 2025, honoured with the Equity in Perinatal Mental Health Award at the Women Who Decolonise event held in the House of Commons in 2026. But what is more is that she is incredibly gentle, incredibly kind and inspirational. And I just had to have her on today for Maternal Mental Health Week to talk about the impact that NICU, fertility, high-risk pregnancies all can have on our mental health and how often we need to be having these conversations about the intersections between those struggles and how they influence each other. So people who have experienced struggles with their fertility, secondary infertility, we talk about loss, we talk about high-risk pregnancies and then resulting in neonatal stays and how all of that influences each other. So let's get into the episode. Julianne, thank you so much for coming and joining us today.
I'm really, really delighted to be here and delighted to be able to talk to you some more. I know we met last year at the Birth Trauma Summit, and I've been watching what you've been doing in this space, and congratulations on everything that you've done so far, and particularly the podcast. So thank you for inviting me on.
Oh, well, thank you so much for being here. Would you be able to just give people a little bit of insight into who you are, what you've done with all the incredible things that you've done, and who you help, who you support?
Yeah, sure. My name is Julianne Boutaleb. I'm a consultant perinatal psychologist. I've worked in this space for 25 years now. And I'm the founder of Parenthood in Mind. We're a specialist team of psychologists and psychotherapists. And I suppose our particular niche is working with parents from the time that they start thinking about becoming parents and possibly running into some bumps in the road in terms of either not being able to conceive quite in the way they thought they would, or that they might need assistance, or indeed if they are a solo parent by choice or potentially a gay couple, they may need assistance along the way to become parents through donor conception and surrogacy. So that sort of area is my specialism within the wider perinatal mental health scenario. And we see parents, as I say, from the time that they're contemplating becoming parents all the way up to and including when their children are age 5.
Okay. All right. Do you mind me asking a little bit about what's drawn you to this kind of work, specifically this specialism?
I think it was probably when I came out of the NHS about 10 years ago. A lot of my clients were based in and around Marylebone. I worked for a particular practice, a couple of different practices in and around Marylebone and Harley Street. And if anybody knows sort of fertility clinics, that is where they're mostly based. So a lot of the people that I started to see, yeah, probably 10 to 12 years ago, started to come in with these sorts of issues. And I became particularly interested in the sorts of issues I was seeing, which was I should be really grateful. I finally have my baby through IVF, but I'm not really feeling it. And then starting to unpick with them what it is that the journey had been thus far, and realizing often something that I've now put words on is that they had gone through reproductive trauma. So, in other words, years and years of trying and failing to get pregnant, possibly early and all the way through to late pregnancy loss. And indeed, some of the people that I started seeing and work now very determinedly with around donor conception were often in a grief process that hadn't had much thought around it, which was grieving one's genetic connection to a child. And that was something that I had some experience with within the organisation I worked in previously in the NHS around adoption, and also parents, unfortunately, who would have their children removed. So it feels like the last 12 to 15 years has been a sort of an integration of lots of different parts of my career. And what I really like about it is that it feels like you can be in different positions and different sort of helping situations with people across their reproductive journey. And that feels really fulfilling.
Yeah, absolutely. And we were chatting a little bit just before you arrived of I think that um this crossover is something that maybe we don't see spoken about a lot. We maybe see a lot about, fertility struggles, and then maybe we see a lot about neonatal care. But for a lot of parents that I support, it's that they have had both in some kind of capacity, or they've been through fertility support and then they've ended up in neonatal care, or they've had one child and then they've struggled with that secondary infertility, or
Mm.
their family feels like it has been decided for them in terms of what this looks like because they've been through
Mm.
neonatal care. And I just wondered if you see similar in the people that you support too.
Yeah, there are a lot of disenfranchised losses along the way when you
Yeah.
have to come through fertility treatment. And I think some of them can remain really nebulous for parents who then finally have a live baby in their arms.
Yeah.
But they might include being able to conceive in the old fashioned way, being able to hold on to an idea of what your family should look like. So that perhaps it is
Mm.
about having a boy and a girl, being able to hold on to the intervals between the children that you have as well. There's a lot of loss. And even though IVF is heralded as the great big miracle that it is, and again, I should also say, I've also been fortunate to conceive in this way as well. So my personal experience has been that I used IVF to have my daughter. But again, I think this was sort of 17, 18 years ago. And I think the sort of general message was go away now. You can join the great unwashed, parenthood gang
Yeah, you're
and
done.
put all of that to one
Yeah.
side. And
Yeah.
in fact, not just through my own experience, but as I say, seeing the hundreds of clients that I have since then, the fact is that that isn't what happens. You are shaped by the journey that you have. And
Mm.
if it is about having to go through very arduous clinical and medical procedures to conceive, that you don't just lose that fear and anxiety when you then become pregnant. So more often than not, that follows through in pregnancy. It then follows through if, considering many of the issues that you've brought up in your community, if then you have a prem baby, if then again you're in a situation where you're having to leave the hospital, come home to an empty nursery room for your child, and it still hasn't become quite real that you've become a
Mm.
parent. And I guess what these parents often have in common is that they have a series of losses that often go unnoticed and unenfranchised by the wider community of parents that they find themselves in. And I think what that can mean is that they often struggle then to identify. So where do they belong? Yes, I'm finally a parent, but I'm not a parent in the way, for example, I thought I would be. And there's no guarantee if I want to become a parent again that I won't have to go back to the clinic and potentially use one of my frozen embryos. So there's something about the trajectory of parenthood for these parents that often means they are off the mainstream track, although at times they can look as if they're on it. And I think what can often be confusing for the individuals and couples I work with is this sense of, but why am I having this feeling about the fact that my sister-in-law is pregnant again? I mean, I'm now finally pregnant myself. Why is that stirring up so many feelings in me? And again, it can often be to do with these disenfranchised losses. Well, she didn't have to go to a clinic to get pregnant. She's already got a little baby and is now pregnant. She hasn't gone through the NICU experience that you had to previously. And I've written about this, and I talk about reproductive trauma. So again, I can share that with you to share with your listeners afterwards. But often what people describe to me is that they get through, and of course these parents are brilliant at getting through things. Often they're using psychological ways of managing that mean that they're in autopilot. They're often quite shut down. They're often going through the motions and getting through all of the different stages of gestation, then through the weeks and weeks of NICU, then going through the milestones for their babies once they come out of NICU. And they often don't have the space to actually register what they've been through for years and years and years. And it's often only when, thankfully and hopefully, the baby gets to a stage where they're more settled, or indeed they want to try again, that they're able to, that they actually start feeling some of the reproductive trauma they've been through. And as I said, that can be really discombobulating when, again, the message often from clinics is, you're a parent now, off you go and you'll be fine. The really unfortunate reality is, frankly, that many often hide those sort of wounds as well and don't want to talk about them because they're afraid to feel or to seem ungrateful. And again, they often find themselves in between two camps, the parenting camp and those perhaps that they've been along on the fertility journey with or in the NICU journey with who haven't emerged with a babe in arms. So it's a very difficult journey to a parenting identity as well.
Yeah, absolutely. I was going to say that part about gratitude and that it's not just you've completed the treatment or you are pregnant now, so you're okay now.
Mm,
It's a gratitude that you now have to feel, isn't it? Like this
mm,
really, like you should be so grateful you wanted this so much. So then to have any other feelings that don't feel like that, it can feel really confusing for
yeah.
parents. Yeah.
Yeah, and very shameful. And I write poetry on this often. It's a way for me to process some of what, parents bring to sessions. And I have written a poem called You Do Not Have to Prove Yourself Worthy. And there is a bit in the poem where I say that baby-shaped hole cannot be filled by this baby. In other words, yes, I'm grateful that the baby is here. But one of the things we often do to get through very lengthy fertility journeys is that we don't focus on babies. In fact, we stay away from babies. We stay away from christenings and naming days and nurseries and all the while desperately struggling to become parents. But of course, there's loss within that you can never get back. You can never get that time back. You can never get that sense often that I actually wanted to be parenting alongside my sister-in-law. Now I finally have my baby, but her little one is 9. That
Mm.
these sort of losses often go unnoticed. And so that's really part of my mission, I would say, is that I really want to widen out that story around
Mm.
IVF pregnancies and the use of assisted reproductive technologies, which are amazing and wonderful. And I wouldn't be a parent if they didn't exist.
Yeah.
But the truth is, the journey can often be much more complex than we're letting on.
Yeah, absolutely. Think that there's the word that you've used a few times within there, and I'm just wondering if you can expand for people who are listening about disenfranchised grief and what you mean by that.
Yeah, so disenfranchised grief is a type of grief that isn't validated by the people around you. So if you think ordinarily, if we lose a parent or a sister or a family member and we're in a workspace and we say, more often than not, you're going to get people giving you their condolences, giving you a card, perhaps even bringing you flowers. You'll probably have 3 days off from work paid. So there's a whole load of processes and rituals, if you like, that we have within our culture around the deaths of particular people.
Mm.
But one of the things that still continues is the sort of the taboo around pregnancy loss, pregnancy endings, stillbirth, and infant death. And of course, these are terrible things to have to imagine. And yet we know that 1 in 4 pregnancies will end before they should. And we also know that we have a very high rate of stillbirth and infant death currently as well. So these things are happening, but often the people that they're happening to, and I guess this also fits into the sense of fertility being a type of disenfranchised loss, aren't being greeted with the flowers or the card or the understanding that, of course, you'll need 3 days off. In fact, we've only just recently heard that Northern Ireland has now become the first place in the UK to offer paid bereavement leave for bereaved parents where pregnancy has ended before 24 weeks, which is an amazing milestone.
Yeah.
But we're still not there in the rest of the UK. So that would mean that you would maybe have to push for leave, or you would have to take sick leave, or you might have to go and have a conversation with your manager about what's happening in order to justify the leave. And so all of these different experiences around the loss mean that you don't feel that your loss is validated. It's very rare for others to say, I get it, I hear you. In fact, what they often get are these platitudes such as, well, at least you were pregnant, or at least you know that you can get pregnant, or, you know, maybe you're young, why don't you try again? And again, that's a disenfranchisement. The idea that one pregnancy can be easily replaced by the next, or one baby in your mind can be easily replaced with another. That's not the case. And most parents experiencing loss will tell you that that's often their struggle, when and if to try to get pregnant again, and how to sort of keep these babies separate in their mind because they have clear continuing attachments with them.
Yes.
So I guess what I'm hopefully putting across is how complex this can be. But unfortunately, if you're not met with people who understand that complexity, then what you're experiencing is a disenfranchised loss or grief.
Yeah. Yeah. And we talk a lot about that kind of loss of experience or expectation of what you thought this was going to look like. And I think that we talk a lot about it around neonatal, and it happens within the pregnancy, and you probably see it a lot as well, but that this is nothing like I thought this was going to be. It's not spoken about. I had no idea that this world existed even, and then this is what my story is. It's like it just feels worlds away from what it was that you're expecting, and I guess that grief lives in that gap between that expectation and that reality too.
Absolutely. So one of the things I talk a lot about, and it's a concept that I heard about probably 15 years ago, 2011, and it's the idea of the reproductive story. And if people have heard me speak before, I speak about this a lot. So it's a concept that was originally talked about by reproductive psychiatrists Janet Jaff and Martha Diamond. And what they started to know is exactly what you were saying, Frankie. People would go, this isn't what I was preparing myself for. And then they would say, well, tell me what it was you were preparing for. And what they started to notice that often those that were experiencing experiences of loss or infertility or NICU experiences, they would start to outline this very beautiful sort of narrative about what they imagined was going to happen. So it might go along the lines of, when I was little, I thought I'd meet somebody. I thought we'd have 4 children. I thought we'd have 2 boys and 2 girls. In fact, sometimes when I ask this question of the couples I see, they will tell me about the names they've already picked out. They may even have a set of clothes. I'm thinking of one couple in particular. He was a huge West Ham fan, and he had a little West Ham strip ready for the child that they thought they were going to have within the first few years of their marriage. And sometimes this is an unconscious narrative. It's something that we hold in our minds and, of course, may share with our partners as we come to this place where we say, shall we try for a family? But of course, what then starts to happen is that this story, this narrative, which is the beginning of a reproductive narrative. So in other words, we often ask people, what are you going to be when you grow up? And they might say, well, I'm a really good dancer, or I'm really good with people, I'm going to be a dancer, or I'm going to be a psychologist, or whatever. And then they work towards becoming that. It's the same with reproductive identity. Reproductive identity is a sense of our bodies being able to get pregnant, being able to hold a pregnancy. It might be there in early experiences of our bodies where, for example, we're taking in our mother's bodies. Well, my mum had 3 children and my sisters had 2 children. And somehow, if my body is part of these, linked to these women, then my body should be able to do the same. Or we may indeed have been told that we have good childbearing hips, or we may have regular periods. So we get to that space where this reproductive story starts to come into very close contact with reality. And what can be absolutely devastating is starting to learn that actually your body perhaps is not as fertile as you thought. That might be through a blood draw, or indeed what you might start learning is that your partner's body, although, you're having regular sex, he doesn't have any sperm in his semen. So what starts to happen then is this dream, this story, this idea of how it was going to be for the two of you and how it was going to be as a family starts ebbing away. And it's a very, very painful journey and a sort of it's not an overnight scenario. It's something that within couples work specific to fertility, we call it the dawning phase of couples work. So it starts to dawn on people that perhaps this idea of themselves as a couple, this idea of themselves as an individual, the timeline perhaps that they had put forward for themselves is now not going to happen. But of course, what often happens in these scenarios is that gets hidden. It can often be surrounded in shame, because these are often people who have put their minds to exactly what I said earlier, to a career. If it's about studying, if it's about getting the money together to train for something, I'm really able to do that. But now I'm in a point in my life where those old techniques, those old ways of coping are not going to get me to this place that I've had in my mind. Yeah. And it can be there can be a real sense of shame. There can be a sense of wanting to hide it. There can be a sense of feeling very othered and very different from the people around you. All of those feelings get buried, I think. They don't get easily talked about.
Yeah, completely. And I think that building on what you've said as well, in something that I see a lot is this kind of, along with the kind of narrative, is this kind of good girl narrative of growing up, of being like, well, if you put the effort in, then you will get the reward. If you are good, then good things will happen to you, that kind of thing. So I think that it then gets to this point where maybe there is a struggle with the fertility, or you end up in neonatal care, or you experience the birth trauma, and it's like, I've done everything good, I've been good, and then you don't get that kind of experience. And again, I'm just wondering whether you see that kind of narrative feeling like it comes out with your clients.
Absolutely. So this often sits into the sense of reproductive trauma that I spoke about. Because what we know happens in trauma is that your beliefs about self, beliefs about other, and beliefs about the world get shattered. So I often talk about shattered beliefs. Exactly as you said, I'm a good person. I work hard.
Did you know that the NICU space is more than just this podcast? We also run an online community created specifically for NICU parents. Whether your baby is currently in neonatal care or your NICU experience happened months or even years ago. Inside the community, you'll find specialist guidance from professionals who understand NICU, resources and coping tools to help with the emotional impact, and most importantly, connection with other parents who really get it. For many parents, it becomes a place where they can finally talk about their NICU experience with people who understand without needing an explanation. If this sounds like something that would support you, you can find out more information in the show notes. Let's get back to the episode.
I do all the right things. And where that fits in a fertility scenario is I'm taking my vitamins, I'm eating well, I've done everything the doctor has told me to do, and still we're not getting pregnant. And I guess those beliefs can get even further amplified when you then start an IVF process, because there is often the projection that this is scientific, this is clinical, we're taking out the role of chance. But unfortunately, if you look at IVF statistics, if you're under 35 and in a cis-het couple, your chance of getting pregnant on any one cycle of IVF is around 26%. So a 1 in 4 chance. And what's amazing about this is that it now mimics basically your 1 in 4 chance of getting pregnant spontaneously. And we can't seem to get it any further than that. And in fact, in the last month, there's been a big research report published talking about the fact that IVF rates are going backwards in the States. Because inevitably what's happening is older and older people are coming to the treatment, often with much more complex fertility issues. And that's really, really difficult for people because often they believe this is their guarantee of a baby. It's the way that they'll be able to hold on to this reproductive story I spoke about. So what you have over and over again across the time that perhaps somebody like you sees a parent in NICU is maybe many, many years of different types of negative reproductive events.
Yeah.
Anything from a fertility diagnosis through to an early miscarriage, through to understanding that actually IVF is not going to work for you anymore and perhaps having to move on to donor eggs or some other form of assisted reproduction. And all of those events sort of chip away at your belief about yourself and about your partner and about the world. And so often people do come through feeling very depleted and very traumatized, and often, as they say, not the same people as they used to be, and often beating themselves up about that.
Yeah, completely. And I think that self-criticism or self-blame then often does kind of come in. And one of the things that I hear people saying a lot is that part of going, my body has failed at the one thing that a woman's body is
Yes.
supposed to do, right?
Yeah.
And you get that throughout the fertility, you get that throughout the kind of birth trauma, the neonatal part, but it's very much this belief of being like, my body was supposed to do this as a woman, right?
Yeah.
You know, so there's a lot there about that kind of, shattered identity and trying to make sense of who you are now and your beliefs and that kind of the story you're telling yourself and the trauma and so many layers of it just within that fertility bit. And I just wondered if you'd be able to talk to us a little bit about what happens for people that when then we layer on neonatal care on top of that, and maybe what you might see if people are then going through birth trauma or then going through neonatal care or having a sick or premature baby, and what you see with that.
Yeah, so it is often a continuation of what you started to speak about, which is this sense of my body failing again. But I think one of the things that can be very difficult for NICU parents is the complicated feelings they feel towards the babies. Often people will say to me, the baby doesn't even look like a baby. They've been born so early. This is not the imagined baby. Yeah. Now, again, I'm saying this gently and compassionately for anybody listening. Of course, we all carry imagined babies in our minds. So going back to that original idea that I spoke about, the reproductive story, the babies we have in mind are often little plump babies with maybe blonde hair or the same eyes as our partner, or they're often not the very sickly babies that we see in the NICU. So often I work with parents who are feeling very guilty about maybe not wanting to see the baby because it's too confronting. Again, it's a sense of reality hitting what the dream should have been. And that can be very difficult to talk about in a couple. So I often work within same-sex couples. And in fact, I'm thinking of one at the moment where it started to become really clear that the birthing parent did not want to see the baby because she felt it was her body ultimately had failed. And this was a case of reciprocal IVF. So the other parent, it was her egg. So there was a real sense of all my body had to do was to give birth properly, to keep this baby safe for 9 months. And I couldn't do that. So that's absolutely on me. And that really unfortunately led to a real delay in sort of bonding with the baby. It took a lot longer for her to be able to go down and see the baby and hold the baby, whereas her wife was much more able to do that. So that's one layer of things. The other layer of things is the degree to which NICU can get in the way of these early parenting identities. These are often very fragile identities anyway, because we've been through a series of getting to a pregnancy at 13 weeks and then losing it. So am I still a parent or not? Or getting to a pregnancy later on and unfortunately experiencing a pregnancy loss. So there is this nebulous sort of identity shift that's happening anyway across time, again, that is not recognized. Who are you actually if you've had 3 or 4 pregnancies, or indeed you've created embryos that you've transferred that haven't took? What is the name for you? What are you? An almost parent, a wannabe parent, a prospective parent? And if we bring to bear some of what we now know about how the maternal brain changes in the first and second trimester, and we also know about fetal microchimerism, so that the cells of any baby that we've carried is left behind as a DNA legacy, it is also not true to say you're nothing, but what are you exactly? So you've got this very fragile identity almost happening over and over again across a period of time. And I think NICU often amplifies that, because you're going home and where is your baby? What sort of parent are you without your baby? What sort of parent are you if, you can't breastfeed, the baby's too poorly, so you have to pump? What sort of parent are you if your baby isn't gaining weight in the way that the NICU team feel they should be? It's just over and over again, this constant having to hold tight to an idea of being a parent that at times may not be what you want, actually. And I think the conditions within which you're becoming a parent aren't always very conducive to you feeling like you're the parent. So often people will say to me, but I think the baby prefers the nurse over me, or prefers my partner. So it's a really unfortunate mix. And I really feel for NICU parents when they've been through these fertility journeys, because it's like, oh, please just give them a break. But that journey can continue for months and months on. And it often stays as a sense of fragility of a parenting identity for quite a while after as well. And I really feel strongly there should be good postnatal psychological care for NICU parents continuing on beyond when they leave the NICU.
Yeah, completely. It's just that transition, isn't it? It's that transition out of being in neonatal care where your nervous system is on that kind of high alert, hypervigilance anyway, but it's also that kind of that sense of identity, that understanding your emotional landscape and what this looks like for you now. It's so complex and there's so many different layers to it. I was wondering whether you could talk to us a little bit about if we kind of start with that identity piece. So if there are people who are listening here and they're going, yes, this is resonating, this feels like me, I feel like I'm really struggling with this kind of sense of who I am or what to call myself, or I just don't feel like myself anymore, that kind of identity rupture that feels like it's there for people. What would you say to people who are in that situation? Is there anything that they can do with that?
Absolutely. So what I always say to people, what can happen to those of us on this journey is that we often get very preoccupied in our minds with what we're not doing, what we're not looking like, what others might pick up. And we often over egg the negative pudding. one of the things I would say, particularly if your baby is still in NICU, is moments of meeting. There are moments where you will be able to have your baby on your chest, where you will be able to put your hand on them and see their breath slow. We know a lot more now about NICU babies. Whilst you may have had a difficult start, the start is not the ending. Yeah. And one of the things I often say to people who say to me, but the timeline's completely out of sync. I've lost this and I've lost that. And I go, but this is forever. This is forever. This baby, please God, will be forever. You will always be their parent, no matter what happens. And it's a mix of two things. One, slowing down and meeting the baby where they're at. The reason that's important, Frankie, is they're the little miniature building bricks of our parenting identity. Mm-hmm. Where we're able to hold an infant or put them skin to skin and see them calm, that's us being able to hold on to our maternal identity, because that's what a good enough mother does. We're able to soothe, we're able to calm, we're able to hold our babies. Mm-hmm. I also say to people, if you're away from your baby, you're still thinking about your baby. So even you being preoccupied about how they are and not being able to sleep at home, that's already the start of the maternal identity. Worrying about them, wondering how they are, etc. The other bit that's important is holding on to the longer term narrative. And I know that's really, really difficult when, of course, our minds throw us into trauma. And as you say, the hypervigilance, the not being able to sometimes bond with babies for fear that they may not be there at the end of the week. I understand all of that. And yet, what I often say to parents is, you will never regret being with, even if that's. And so I often work with them saying, what is it that you can manage for today? Is it 5 minutes? Is it about just sitting beside the incubator? Is it about going in and having your partner go in after you and not being there for too long? So what is it that you can manage? You will never regret those moments of meeting, of being present. But often what I see is parents might regret not being there in some ways, in terms of, and again, what I would always explain to them is, this is your autonomic nervous system managing something. And sometimes we want to get away. We want to get away from what's overwhelming and what's scary, even if it's our own babies. So again, as you know, I work a lot around birth trauma and babies, and there is a downloadable leaflet on the Make Birth Better site, which maybe we could share with the listen notes afterwards. But there are a couple of tips in there as well about how to gradually build up the building blocks of bonding and attachment with your baby post-trauma.
Okay, brilliant. Yeah, we'll definitely share that, because I think that was something that I would love to be able to talk to you a little bit more about. But one of the things that I wondered if we could just spend a little bit of time on, because I don't think that this gets spoken about enough, is maybe you've been through an experience where you have had a child through most of my parents that I work with through neonatal care. And then it's that part of thinking about expanding your family, and that there may be parents who are then experiencing secondary infertility or loss afterwards, or where maybe they have had to have a hysterectomy and the decision has been made for them, or because of the way that it impacted their mental health, or they're not, the risk feels too great. It's like, and I guess this maybe goes back to that narrative part of being like, this is not what I thought this was going to be. I am grieving the child that I thought I was going to have, but we also have another child. And I wondered whether we could talk about that experience and how unique that in itself is too.
Absolutely. So in the wider birth trauma literature, there is this experience called the ripple effect. And really, unfortunately, we now know, and this was a longitudinal study across 15 years, I think, that family size, that often individuals and couples who experience perinatal trauma do not have the family size or the family that they thought they would have for precisely the reasons you're talking about. In other words, the ripple effect goes beyond actually surviving traumatic perinatal events like NICU and premature birth. What this means, and I think the other thing I want to talk about, is the couple's capacity to have another baby as well.
Yeah.
One of the things when people have had to go through fertility treatment is they often speak about the fact of what decisions they've had to make, often with huge time pressure involved, often with very little assistance in being able to think through what the real long-term consequences of those things might be. And let's be honest here, these decisions range from do you want to have more IVF when sometimes there isn't the financial wherewithal to have IVF, through to your baby's really poorly, we don't think that they're going to pull through, should we stop treatment? I mean, parents on these pathways are often faced with absolutely unenviable decisions. And as I say, it's really important. I often talk about forgiveness when I work with parents, a sense of being able to. So, one of the tasks might be to rewrite the reproductive story, the ways in which it was difficult, but also the ways in which we were able to come together as a couple. We were able to make decisions. We holding on to the resilience of the couple, holding on to what those experiences have made of us as parents. And sometimes that is about gratitude and enjoying every minute. Not necessarily, but it can also be. But I think there's also, as you say, something that's less talked about, and it is almost, if you can imagine, a family picture where there are babies missing. So babies who didn't land earthside, or babies who, there's a beautiful piece by Juliet Miller, and she talks about mourning the never born baby. And the never born baby is the baby you're talking about. We just can't put ourselves back through that again. I'm not sure my mental health would survive. I'm not sure we'd survive as a couple. I'm not sure we'd be able to look after Molly and Julie, who we already have. And maybe we just have to stop here. And the grief around that not being recognised, that secondary infertility piece, where again, often there's a sense, but you already have one, or you already have two. Or indeed, you get the very unhelpful commentary about better make sure to give your little one a sibling. It's very important. And I remember facing that in the different sort of family spaces I occupied. I'm Irish, hopefully people can still hear that. And my ex-husband was Algerian. So he was one of 12, I'm one of 5. And every single time we went either to Ireland or Algiers, there was the same question: when are you going to have another? Little did they know we couldn't. And it's that sense of how the reproductive story can continue way beyond, having a baby in NICU in ways that can be very painful. I guess the other thing that can happen, and I am going to speak a little bit about this, is where mothers are older or where there have been fertility issues related to age, that actually you may not be able to continue having children into your 40s. And yes, you may be given the option of donor eggs or surrogacy, but again, just because an option is there doesn't mean it's right for you and your family to take that. And I really think those sorts of endings to a reproductive journey are not held well. I also talk about the fact that for some, it is about letting go of embryos. That yes, they've had the 2 children they wanted, they would really like a third, but they can't put themselves through it again. But in their minds, those embryos are the same as the 2 beautiful children that they're raising now. So I guess I just want to, and I hope this resonates with listeners, I know how unseen so many of these struggles are for you, particularly if it's a place in your family building journey where you're saying, I don't think I can. And I don't think anybody does that lightly. I think there's often huge guilt and often huge worries about bringing up a one and only, for fear that they won't have a sibling to rely on. I often have parents talk to me about what will happen when I get older and they won't have a sibling to make decisions with and so on. And yet we have to sometimes forgive ourselves again for what we sometimes have to decide. We're human
Yeah.
beings. And
Mm.
I do think this part of life, often when it doesn't work out for you in quite the way that you thought it would, I think it can be very painful, but it's also not a pain that's easily recognized by others who may have very glibly been able to have the number of children that they wanted.
Yeah.
So, yeah, I really
Yeah.
do understand that.
Yeah, completely. And I guess I work with a lot of parents who experience that grief again. We're talking about that grief, that loss of an experience of imagined children, of that expected whatever you thought this was going to look like, and
Mm,
it being so very far from that, and kind of
yeah,
feeling out of your control, out of what you maybe wanted it to look like.
yeah.
With the people that you work with, if they are experiencing this grief and this loss, what are some of the ways that, again, if people are listening and resonating with this, what are some of the ways that people can cope with that feeling, that grief and loss,
Yeah.
especially if they're feeling like other people don't get it around them?
Well, this is what I call rewriting the reproductive story. So it's being
Right.
able to look at the ways in which, yes, your story was different, but are there parts of your story that you're proud of? Are there
Yeah.
parts of your story? And I guess this is the post traumatic growth part, isn't it?
Right.
Parts of your story, and I know this from people I work with, that now enables you to help somebody else. And I often say to people, what you're going through now may become a template for somebody later on behind you, where you're able to say, actually, make sure that you're surrounded by people who get it, or don't make excuses for yourself. If you need to just leave a christening party, do it. So, is there
Yeah.
a way in which that can be some of the legacy of
Mm.
what's happened? And again, within the phases of infertility model that I work with, legacy is one of it's the last stage of a
Mm.
fertility journey. What is your legacy in terms of your parenting of the children that you do have? Is there something that's changed? And often I work with people and they decide that actually they're going to work part time because they realize they're not going to have the second or third child, and they really want to have all of the firsts and lasts with this child in a way that makes them very, very present, and sometimes more present than they might have been if they'd had the children they thought they would have. Likewise, is it about finding a renewed commitment to
Mm.
children? Is it about, retraining? And again, that's often something I see people do, either going back into the fertility sector as a sort of a lived experience expert, or
Yeah.
somebody who takes up a position with children, perhaps being a reader in the school or whatever, so that they're able to still hold on to a sort of a parental like identity. But I think often one of the key things I see is about expressing the grief, about being able to let go and make peace with the life that we have rather than the life that we hoped we would have. And I think what's very important about that, and I hope this doesn't sound too stern, but I think if we don't do that as parents, if we're not able to get to that as parents, I think unfortunately it can come into our relationship with the children that we have.
Mhm.
And you can come in the space of being overprotective or even being overindulgent. It can also be there in terms of expectations that we may have of our children. And I find this sometimes around gender disappointment, for example, where you haven't had the boy you wanted or the girl you wanted.
Yeah.
And then that can unfortunately flavour the relationships you have with the children that you have. So I would say go easy on yourself, be compassionate. But if there is anything sort of left over from your journey through fertility and loss and NICU, potentially it is about seeking out somebody like yourself or myself to sort
Mm.
of work through some of those issues so that they don't get stuck in
Yeah.
your parenting journey.
Yeah, completely. And I think that for some people, it's that belief of time being something that heals, but for some people, it
Yeah.
does feel like it's a stuckness that feels like it
Yeah.
needs help. Not everybody, but for
No.
some people, having that kind of support is important.
Yeah.
Thank you so much for that. I honestly feel like I could keep going and asking you loads and loads of different stuff with your wealth of knowledge. But as we kind of come to the end, is there anything that you wish I'd asked, or is there anything that you really want people to take away from this conversation?
I think I really want them to take away that we have to forgive ourselves over and over often in this journey. And that might seem really strange to say.
Yeah.
I think those of us who are used to excelling or conforming or doing the best we can in other parts of our lives, I really do feel becoming a parent can be a very humbling journey for many of us. And I include myself in that. There is something very life-changing when we experience these experiences, both within our bodies and because of our bodies, and within the relationships that we are in, either with our partners or our siblings or with other people who go through these experiences. And I do think one of the sometimes very hidden treasures of going through these experiences is a great understanding of how fragile life can be,
Yeah.
but also how amazing it can be. We often hold experiences of becoming pregnant against the odds, of having children that have survived against the odds. And I do think we need to hold on to those experiences as well.
Yeah, completely. Thank you so much. I love that. Hidden treasures. I love that. Thank you so much for your time. We're going to put all of your information below so that people know where to find you. We'll also link the resources that you've spoken about as well so that people can find you. And yeah, just thank you so much for everything that you do in this space and the way that you talk about everything as well. So thank you.
Really welcome. Thank you for having me. Thanks, Frankie.
No worries. Thank you so much for listening to the NICU Space podcast by Miracle Moon. If this episode resonated with you, please know that support is available and you are always welcome in our community. If you found this episode helpful, one of the best ways to support the podcast is by sharing it, leaving a rating, or subscribing. It helps these conversations reach more NICU parents who really need them. You can also find us on Instagram and across social media at Miracle Moon UK, or explore more resources at miraclemoon.co.uk. Wherever you are in your NICU story, please remember this: you are not alone.